welcome to Pediatrics by Dr. Anand. In this topic, we're going to talk about very important, one of the very beautiful topic that is nothing but our intraventricular hemorrhage. Now we have started in the December month. We have this what you called our target is Conquer NEET PG, and in this segment we're going to talk about very important top 60 topics which are very important for our exams to clear. Okay, and for that we have to cover important amazing topics so that you can get a very good rank in the our NEET PG exam. Okay, so hello everyone. Hello Sandhu, is my voice audible to everyone? Please let me know. So in this segment we're going to talk about, I'll repeat again, we in this what you call Unacademy app, we have something known as plus subscription and something known as iconic subscription. In the plus subscription you have this amazing access to all my recorded and live lectures. I mean, thank you so much for the amazing response already, because we have done some 25 neonatology series and they have been super hit. Now we are starting with Conquer NEET PG, where we are covering more additional topics of respiratory, cardio, neuro and growth and development, and milestones also very important. And with the plus subscription you get to meet and you get to access to all the amazing educators all over the world on one platform. And yes, you can have all the amazing tests and quizzes which you can do it wonderfully. Also, you can watch my face, my teaching on your iOS, on your Android and on your laptop, and you have access to n number of questions. हेलो हामिद, हेलो कॉम्बैट, हेलो संधू। मतलब कुछ नाम तो ऐसे हैं जो हमेशा ही ज़िंदगी में रहते हैं, जैसे कि हामिद, कॉम्बैट, Sandhu, Bhim, very good. And also at the same time, in the iconic subscription with the Unacademy subscription, you're also getting the prep ladder subscription. You're also getting the prep ladder subscription, all the clinical notes, lectures, question banks, rapid revision, everything possible. Okay. And also for the newcomers, we have something known as special class on the Unacademy app. Some segments of the pediatrics will be taking on the YouTube and some segments over the Unacademy app. And in the Unacademy app, we have a wonderful option to make a MCQ and make a poll out of it. You can ask your doubts wonderfully. You will never miss my class because all the lectures will be recorded. And also at the same time, whatever I write, I teach will be, you can download it into a lecture note and you can watch them or you can read them later. And I will try to make the classes as interactive as possible. Okay, very good. And again, a beautiful congratulations to all our amazing NEET PG September 2021 candidates who have top rankers in our platform. And yes, the next segment for March 12 2022, we have Hamid, Sandhu, Combat and many new beautiful names whose faces will be there on this platform. And also, that we have already started the target NEET PG 2022 revision batch. Basically, we started for 1st December. It has already started, where in a very well structured manner we're gonna cover everything possible which is required for you. Okay, and then of course you can boost your medical PG prep. You can boost your knowledge. Of course, if you take a 6-month plan, you get 1 month complimentary. You get a 12 months plan, you get 2 months complimentary, and if you get a 24 months plan, you get a 4 months complimentary. All you have to use is use your educator's code. Like for example, here the code is nothing but Dr. Anand. If you use this code, like it will be little financially comfortable for you to take the whole plan. So that is the only thought process behind it. So let's start the whole journey. Let's start a wonderful topic. Hamid, are you ready? Combat, Sandhu, Bhim, शुरू करें. Today's topic of choice is nothing but neonatology. The subtopic of choice is nothing but intraventricular hemorrhage. IVH. Today's topic is IVH in the newborns. Intraventricular hemorrhage. ठीक है. Hello Virish Rajput. Okay, now listen very carefully. This topic will be divided into part 1 and part 2. In the part 1, for 30 minutes or 30 to 40 minutes, we're going to cover on YouTube. And today at 1 o'clock, I have the part 2 on the special class. So today itself, we're going to cover this topic. As this topic is little big, so we'll divide in part 1 and part 2. It will be easy to, grasp and easy to retain. Okay. Hi Sandhu, what's up? Morning. So, and whenever we start a beautiful session, we always have a motivating quote. The quote for today is: people will break you. People will break you. They will hate you and they will shake you. People in the society, people in the world, our competitors, whatever we say, people will break you, they will hate you and they will shake you. But how strong you stand is what makes you. Don't you agree with me? Anyone? Sandhu, what do you think? How's the quote? People will break you, they will hate you, they will shake you, but how strong you stand is what makes you. The moral of the story is that you will not get affected by surroundings, you will not get affected by people around you, you will control your temper, you will control the words coming out from your mouth, and you try to hold your vision, hold your aura, okay? And that's very important. So people will break you, they will hate you, they will shake you, but how strong you stand is what makes you. Okay. Starting with this beautiful topic, let's start the intraventricular hemorrhage. Today's topic of choice is IVH. IVH, intraventricular hemorrhage. There's a blood bleeding in the ventricles, or you can say around the ventricles also. So can we appreciate this beautiful picture? Can we see that these are the ventricles? Have you heard about the lateral ventricle, or I would say third ventricle and fourth ventricle? Have you heard about the names? We have something known as, we have ventricles in the body, in our brain, where the CSF flows. We have lateral ventricle, we have third ventricle, and we have fourth ventricle. These are the ventricle. Have you heard the name? This is the fourth ventricle, this is the third ventricle, and the big one, this is the lateral ventricles. Yes, have you, we have heard the names, right? Very good. Now these ventricle, like, again, what is the topic? The topic is intraventricular hemorrhage. There is bleeding, there is bleeding in the ventricles, or you can say around the ventricles. So we all know that beautifully, like this one is our lateral ventricle, this one is our third ventricle, and this one is our fourth ventricle. Can anyone tell me lateral ventricle and third ventricle are connected by which foramen? Any random guesses? Lateral ventricle and third ventricle are connected by foramen of, yes, very good, they are connected by foramen of Monro. They are connected by the foramen of Monro. And the third ventricle and the fourth ventricle are connected by which path? Any idea? The third ventricle and fourth ventricle are connected by, any idea? Yes, we have aqueductal canal of Sylvius. है ना? Have you heard the names? Yes or no? Am I making sense to you? Hamid, नाम सुने आपने ये? So in our brain we have ventricles. In the ventricles CSF flows. We have lateral ventricle, third ventricle, and fourth ventricle. From between lateral and third ventricle there is a foramen known as foramen of Monro. Between third ventricle and fourth ventricle there is a foramen, or I would say canal, aqueductal canal of Sylvius. Okay. Okay, this is the basic stuff you need to understand. Now, that's it. Did you understand this much? I hope you have understood. Let's finish one PG question here only. Please remember aqueductal canal of Sylvius. Aqueductal canal of Sylvius का stenosis is the most commonest cause. Is the most commonest cause of non-communicating hydrocephalus. Non-communicating hydrocephalus. I'll repeat again. There is something known as hydrocephalus. Hydrocephalus means you can say the CSF has been accumulated above. Why? Because there is stenosis. Because the path between the third and fourth ventricle, that aqueductal canal of Sylvius, there is stenosis of that. It is a very narrow, the narrowest part, 4 millimeter in diameter. So this part ka stenosis is very common. So you remember the most commonest cause of non-communicating, any problem in the lateral ventricle, third ventricle, fourth ventricle, this pathway, any problem, no, any stenosis, any problem, for that will lead to non-communicating hydrocephalus, non-communicating. So remember the most commonest cause of non-communicating hydrocephalus will be aqueductal canal of Sylvius stenosis. So this canal will block and CSF will start accumulating above, lead to hydrocephalus, lead to hydrocephalus. So in this slide, one question we have covered, that the most commonest cause of non-communicating hydrocephalus is aqueductal canal of Sylvius stenosis. The second part which we have covered in this slide is that there are ventricles, lateral ventricle, third ventricle, fourth ventricle, where the CSF flows, CSF pathway happens through them. This slide we have covered this much. Did you understand, Hamid, Dr. JP, Sandhu, Virish, Combat, Sandhu, everyone, and Bhim? Okay, very good. Very good. Done. Let's move further. Is IVH common in preterms? Now again, now it has to be very interactive sessions. ऐसा नहीं कि I am only teaching. You have to communicate. You have to give your comments so that we can come to a better conclusion. So is IVH common in preterms? Yes or no? Any idea? Is intraventricular hemorrhage common in preterms or not common? The answer is yes. Sandhu is right. It is common. It is very common in preterms because like please remember, the more the baby is preterm, the more the vessels of the brain, same, the vessels in the brain are very sensitive. They are very sensitive, they are very fragile, they are very thin, so they can lead to intraventricular hemorrhage. IVH can happen in the preterms because of the very sensitive, fragile and very thin vessels. So yes, intraventricular. First question is, can IVH, can it be seen in preterms? Yes, definitely it can be seen in preterms. Next question is, which is the most commonest site? Which is the most commonest site of IVH? Please remember, any random guesses? That's a NEET PG question. Every star mark is a NEET PG question. Which is the commonest site for intraventricular hemorrhage? The answer is nothing but germinal matrix. The answer is nothing but germinal matrix. What is germinal matrix? This part, this part. This part is nothing but the germinal matrix. Please remember, intraventricular hemorrhage is also known as germinal matrix hemorrhage. Intraventricular hemorrhage is also known as germinal matrix hemorrhage. This topic we're going to cover in a very beautiful, very beautiful way. Hello Isha, you are late. Where were you, Isha? It's already how many minutes over? 9 o'clock, 9, 10 minutes over. So remember one thing, I'll repeat again. What are we studying? Neonatology. Which topic? Intraventricular hemorrhage. Which is the most commonest site of IVH in preterms? Germinal matrix is the most commonest site of IVH in preterm. Photographic memory is everything. You saw the photo, I showed you where is germinal matrix in our brain, and वहां से bleed out होना is very common, very common. ठीक है, again a very beautiful picture. Can we appreciate this? Yes or no? ये GM जो लिखा है, the GM which is written over here, that is nothing but this part, that is nothing but germinal matrix. Germinal matrix. ठीक है. Isha says, sorry, I was sleeping. Sleeping? Where is your alarm? I also got up in the morning. I dropped my niece to school. Then I went to gym, and now I am start teaching you at 9:30. Why you got up late? Early to bed, early to rise, make the person shiny and wise. ऐसा कुछ है ना quote? Which I follow less, but it's fine. So yes, what you called? Yeah. So what did we learn in this slide, sir? In this slide, we learned that can we see IVH in preterms? The answer is yes, we can see IVH in preterms. Which is the most commonest site, sir? Germinal matrix. Germinal matrix is the most commonest site of IVH in preterms. Okay. And why only germinal matrix? Because same, I told you, right, that the vessels are immature and there is a poor tissue support. Again, listen to me, my dear friends. Don't cram. Understand the concept. You don't have to cram vessels are immature and there is poor tissue support. No, just remember, more the baby is preterm, more the vessels are thin, they are fragile, they are fresh, so they can lead to trauma, they can lead to hemorrhage. So germinal matrix is the most commonest site जहाँ पे ये देखा जाता है, where it is seen, है ना? Yeah. Sandhu says healthy, wealthy, wise. Okay, that's nice. Good. Okay. Yeah, this is a good question. Let's see now. Now it's an interactive session, okay, dear. So try to participate. I ask you, is IVH common in preterms? You said yes, sir. Preterm में बहुत common होता है. Is IVH common in term babies? Any random guesses? Is IVH common in term babies? Sandhu, Isha, Bhim, our again Isha, Hamid, Dr. JP. What do you think? Combat and Bhim. इज आईवीएच कॉमन इन टर्म बेबीज? देखा जा सकता है या कम देखा जाता है, बिल्कुल नहीं देखा जाता? व्हाट डू यू थिंक? सी, द मोर you participate, the more you have chance of clearing this exam only in this one go. So try to participate. Okay, yeah, Isha and Sandhu and Hamid is very right. Please remember, in term babies, germinal matrix involutes after 34 weeks and vascular integrity improves. So it's less common in term babies. So what did we learn? That it is less common in the term babies. Why, sir? Because the germinal matrix hai, it involutes. Involutes matlab it's totally formed properly after 34 weeks and vascular integrity improves. Okay, so vessels were immature in the preterms and now they are mature enough in the term. That is why, sir. So any baby who is less than 34 weeker or preterm baby, you can see IVH, but after 30 is a star mark. It has been a question. After 34 weeker, you see less chances of babies going into IVH. Very good, Isha Srivastav. So yes, why do you say less chances of baby going into IVH after 34 weeks? Sir, vascular का vessels का integrity improve हो जाता है, and also sir the germinal matrix which was kind of forming, it forms properly. It involutes after 34 weeks of life. Done. I hope we have covered 4 MCQs we have covered right now. Next slide. Okay, this question only came. It came in AIMS 2019. Intracranial bleed in premature infant is seen in what? Intracranial bleed in premature infant is seen in what? The options are germinal matrix, corpus callosum, basal ganglia, and choroid plexus. The answer everyone knows. Even my grandmother also can answer this. Germinal matrix. Germinal matrix is the most commonest site, And remember, CSF is formed by the choroid plexus. Like CSS is formed, like you can say by or from the choroid plexus, and then the CSF runs in the lateral ventricle, then in the third ventricle, and then in the fourth ventricle. So lateral ventricle, third ventricle, and fourth ventricle CSF flows, but it is started forming by the choroid plexus in the brain. Okay, next. Yes, a very simple topic, a very happy topic it is. With a very positive energy, I want you to finish this topic. What are the various grades? What are the various grades of intraventricular hemorrhage? What are the various grades of IVH? बच्चे को हो गया IVH, germinal matrix में they were hemorrhage has happened. Now it has grades. Please remember there are 4 grades. There are 4 grades. Grade 1, it's very easy. It's very easy. See, grade 1, when the hemorrhage is confined to the germinal matrix, when the hemorrhage, sir, it is confined to the germinal matrix. Which is germinal matrix? This one. This is the germinal matrix, or I would say this one. Okay. So in the grade 1, when the hemorrhage is confined to germinal matrix, that is grade 1. When the hemorrhage is confined to 10 to 50% of lateral ventricle without any enlargement. See, this was the germinal matrix, right? And this whole thing is the lateral ventricle, yes or no? So now in grade 2, at least 10 to 50%, 10 to 50% the hemorrhage has been confined to the lateral ventricle, but there is no enlargement. There is no enlargement. Means it is confined to the lateral ventricle, but there is no enlargement. I'll repeat again. There are 4 grades of IVH. Grade 1, when the hemorrhage is confined only to the germinal matrix, that is grade 1. When the hemorrhage is confined to the lateral ventricle, or it is covering the 10 to 50% part of lateral ventricle with no enlargement, that is grade 2. Grade 3 में क्या होगा? With enlargement. So in the grade 3, when the hemorrhage is more than 50% of lateral ventricle, which is lateral ventricle, ये वाला, ये पूरा, that is the lateral ventricle. So it has involved more than 50%, more than 50% of the lateral ventricle with ventriculomegaly, with ventriculomegaly. The ventricles have become little big now also. It's very easy. Okay, yeah, very good. Isha is answering so well. Very good, Isha. Very good. I'll repeat again. What are we studying? Neonatology. Which subtopic? IVH. What are the grades of IVH? Sir, there are 4 grades of IVH. When the hemorrhage, intraventricular hemorrhage, the bleeding, it is confined to the germinal matrix, sir, that is grade 1. In grade 2, it is confined. First of all, it is involving 10 to 50% of lateral ventricle without any enlargement. And in grade 3, sir, in grade 3, more than 50% of lateral ventricle is involved. And also, sir, I could see a ventriculomegaly also. And sir, in grade 4, periventricular hemorrhagic infarction. Periventricle matlab, see this is ventricle. Okay, so periventricle means around that full periventricular area there is hemorrhage and also there is infarction. So periventricular hemorrhagic infarction, PV, is known as PVHI, periventricular hemorrhagic infarction. So that is the grade 4 of the IVH. Did you understand this much? Sandhu, Hamid, Isha, Bhim, Combat, and our other amazing students. Very good. Okay, so done. Let's move further. Okay, yeah, this is a very good question. So next NEET PG question is star mark. Again, this has been a question. What is the imaging of choice? What is the imaging of choice of screening and diagnosis of IVH? That hemorrhage which has happened in the germinal matrix, and it now it became so big, so big. So my question is, क्या कराएं? कौन सा टेस्ट कराया जाए? डॉक्टर साहब बताएंगे जरा. So CT scan कराएं, we should do MRI done, or you should want to get a ultrasound cranium done. What do you want to get done? Sandhu says MRI, and Isha says USG cranium, and Combat also says MRI. See, very good. You're using your brain. See, always I tell you one thing, dear everyone. Like whenever you're reading a topic, no, read as if like you are genuinely treating that patient. Like you're genuinely like you are there doing it. Like बच्चा आया, you diagnose IVH, अब diagnose करना है इसको, imaging करना है. It's like you yourself are imaging, you are yourself ordering an imaging. Okay, you get an MRI done. Let's see an MRI picture. Imagine that way. So that way you'll never forget. Okay. So very good. So the imaging of choice, remember, Combat, what you call Isha and Sandhu, is USG. USG cranium is the best investigation choice for the imaging of choice for screening and diagnosing of intraventricular hemorrhage. Because why? Because you know, right, we have something known as anterior fontanella. Have you heard of anterior fontanella, which is present over here? So from the anterior fontanella, there is a space, like, because the bones are still going to get fused, right? Have you heard, right? This is my normal skull, and these are my sutures, like that. Okay, this is my skull. Okay, this is my nose. So this is something known as metopic suture. This is known as coronal suture. This is known as sagittal suture, and this is known as lambdoid suture. Have you heard the names of the suture? Yes or no? नाम सुना है आपने? Very good. And also, once there are sutures, this space in between, this one, this space. Now this is nothing but anterior fontanella. This is the anterior fontanella. So I am going to put a probe. I am going to put this probe on the anterior fontanella because I'm getting a picture. I can visualize inside of the brain because this area is open now. When does anterior fontanella fuses? Any random guesses? When this anterior fontanella totally closes? Any random guesses? Yes, 8 to 18 months. 8 to 18 months, the anterior fontanella closes by 8 to 18 months. It is the last fontanella to close. So the मोटा बात ये है, the imaging of choice for screening and diagnosing of our intraventricular hemorrhage is nothing but USG cranium. Why? Because the ideal window, because USG, because anterior fontanella, it gives you a window, the ideal window offered by anterior fontanella, number one, and it is very easy and quick acquisition of the bedside. It is a very quick method of bedside estimation of any IVH is there or not. You know, you can do bedside USG cranium. You know, you can do by yourself. You can call the radiologist for a bedside USG cranium. Yes, and even Isha is right. Anterior fontanella, which I was talking, anterior fontanella. Let's do the previous picture. Yeah, anterior fontanella, it closes by 8 to 18 months, and some book says by 24 months also. Anterior fontanella closes by 8 to 18 months, और कई books कहती हैं कि 1-2 साल भी लग जाते हैं. 24 months it can take for the anterior fontanella to close. So I'll repeat again, why sir, why ultrasound is a better choice over here? Because ultrasound, the ideal window, because anterior fontanella is giving me a chance to detect things very easily, right? So ideal window offered by the anterior fontanella, that is one good thing. Next is very easy, USG cranium is very easy to do, and number 3, it is very quick acquisition bedside, like quick diagnosis you can do bedside, and also lack of radiation hazard, lack of MRI or CT, also Tesla scans, these all need major huge radiation is there, so lack of radiation hazard. So these are the the benefits of doing a USG cranium. Did you understand this much, everyone? समझ में आया कि नहीं आया? Now tell me this much first. Okay, Sandhu says, what if the baby is past 18 months? Yes, if the baby is past 18 months, then we get MRI done. Then we get MRI done. MRI will tell us that IVH is there or not there, like that. And usually, in some cases, CT scan also, whenever there is trauma or bleed. But here, IVH, by a newborn will have IVH so late. In general, it is more of a preterm issues like that. But whenever there is a bleeding more, CT scan gives a better picture. Whenever you want to look for a bleed, then CT scan is a better answer. Okay, done. Okay, let's revise. Let's do a very quick revision. What did we study till now? We have covered very beautifully at this one. So today's topic is IVH in newborn, and people will break you, they will hate you, they will shake you, but how strong you stand is what makes you. And then in the IVH, we studied about the various ventricles. We studied about that IVH is common in preterms because the commonest site is germinal matrix, we read, and we also read because the vessels are very immature and very fragile, so it is common in preterms. Then also we read that it is not common in term babies because the vascular integrity improves after 34 weeks, so it's not common in terms babies. And also we did one AIMS 2019 question, and then we studied the four grades of IVH. In the grade 1, the IVH was confined to germinal matrix. In the grade 2, it was again confined to the lateral ventricle, and only 10 to 50% it was involving the lateral ventricle. In grade 3, it is having ventriculomegaly. At the same time, more than 50% hemorrhage has been involving the lateral ventricle. And grade 4 is PVHI, periventricular hemorrhage infarction. Okay, that's it. Then imaging of choice is transcranial ultrasound is very nice because it is easy, it is very quick, it is very bedside procedure. Anterior frontal lobe gives us a better window period to to avoid any kind of radiation hazards. Done. This much everyone have understood, right? Yeah. Hmm. Yes, ईशा इज राइट. ठीक है, चलो अच्छा, अब आते हैं अब अच्छे अच्छे क्वेश्चन और स्मार्ट स्मार्ट क्वेश्चंस. लेट्स फिनिश मोर क्वेश्चंस. ओके, what is the presentation of IVH baby can come with? That is the next question. Okay, very beautiful question is this. Like Sandhu gave me a call. Sandhu says, सर एक बच्चा एडमिट किया है सर, मेरे को ना IVH लग रहा है सर. I have admitted one baby, Dr. Anand, and I think this baby is showing clinical features of intraventricular hemorrhage. मैंने कहा, oh my god, how do you know this baby is showing you IVH features? ऐसे कैसे? So okay, Isha says clinically silent baby. Sandhu says seizures. Okay, so anything else, Hamid? कैसे intra, if my brain is bleeding, if I'm having intraventricular hemorrhage, what all I can throw to you? Yes, definitely I can throw seizures to you. Yes, lethargy is a good one. Any palsies or any focal deficits? Yes, that is also right. So IVH baby can come to you with three things. What are the presentation of IVH baby can come with? Either the baby can come clinically silent, either the baby can come in a saltatory presentation. I will tell you what is saltatory. And third is catastrophic, means very very bad. Okay, so baby can come. Yeah, very good, Isha, you're answering very nicely. Actually, I'll tell you, very good you're answering actually. When did we start the class? 9:30, no? Okay, yeah. 30 minutes over, 10-15 minutes more left, then this part one will be over. What are the presentation of IVH baby can come with? Either the baby will be clinically silent, पता ही नहीं चलेगा कि उसको IVH है. Number two could be in a case of saltatory, and number three could be catastrophic. So, NEET PG question number one, the NEET PG question number one, among this clinically silent, saltatory and catastrophic, which is the most common presentation of IVH baby in newborn? What do you think? सबसे most common बच्चा क्या प्रेजेंट कैसे प्रेजेंट कर सकता है? What do you think? Anyone? Any random guesses? Is the baby clinically silent cases are more common, saltatory are more common, or catastrophic are more common? Yes, very good. The best answer is clinically silent. That is the first NEET PG question. The most common presentation of intraventricular hemorrhage in a newborn is clinically silent. That is the first thing. Okay, okay, listen everyone, like have a imaginary picture in your mind. A baby has come of IVH, but it's very unexplained, like it's kind of very clinically silent. And the least common, that's another next NEET PG question is, which is the least common presentation? Which is the least common presentation of IVH baby can come with? The answer is catastrophic, means in a very 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 bad state. That is the least common, and clinically silent is the most common. ठीक है, I hope you understood this much very beautifully, very nicely. We are covering the entire heavy, it's a very heavy topic, it's a very heavy topic, but we are covering in a very simple and very very ऐसे ही बस मजाक मजाक में हम खत्म कर रहे हैं, ठीक है. The most common presentation is clinically silent baby. The least common or presentation is catastrophic baby. Now, clinically silent. Clinically silent, yes. The only clinical sign will be unexplained fall in hematocrit. This is a very important picture. As what you called this Isha told, a baby of IVH. For example, a preterm baby is there, okay? He was fine on day of life 1. Imagine he was just fine on day of life 1, and day of life 2, 3, 4, he was fine. What happened suddenly on day of life 5? Suddenly of day of life 5, the baby is looking very pale. The baby is looking very, very pale. So suddenly, like, very quick fall of baby's condition, very sudden pallor. Within one day, बच्चा कल तो ठीक था, अरे इसको तो आज इतना पेल क्यों लग रहा है ये? इसको IVH हो गया, इसको IVH हो गया. In last week also we had a baby in our hospital in NICU. He was a preterm baby. He was a 32-weeker baby. Till day of life 4, he was perfectly fine, like normal on this orogastric feed followed by paladai and all that. But suddenly on day of life 5, so within like next day, he had like full pallor. And then we got a ultrasound done and he was having IBS grade 3. So like that, they deteriorate very fast. There is always a clinic, only clinical sign will be unexplained fall in hematocrit. Okay, unexplained fall in whenever the hemoglobin breaks down. Yeah, that's what. संधु इज आस्किंग कैटास्ट्रोफिन एंड सॉल्टेटरी कैसा होता है सर. यस डियर, आगे वही आ रहा है, मैं बताता हूँ आपको, आगे आ रहा है वो, ठीक है. सो आई रिपीट अगेन, व्हाट आर वी स्टडिंग IVH. इन द IVH व्हाट आर वी रीडिंग, द मोस्ट कॉमन प्रेजेंटेशन इज क्लिनिकली साइलेंट, मतलब कुछ अनएक्सप्लेन्ड पैलर and unexplained fall in hematocrit. See, whenever the hemoglobin breaks down, when the hemoglobin breaks down, of course, the hematocrit level will go down. Hemoglobin will fall in my body, my hematocrit will fall down. Okay, if the hemoglobin increases, like in a case of polycythemia, when HB increases too much, my blood becomes very viscous and hematocrit level also increases in polycythemia or hyperviscosity syndrome, or when the HB is very high. And then when the HB is very low, my hematocrit also falls off. Hematocrit is also known as PCV, packed cell volume. It falls off. Okay, so unexplained fall in hematocrit, number one. And also, this you know already, what is hematocrit. Yeah. What is the more, okay, so yes, now saltatory, as Sandhu is saying, sir, saltatory वाला बच्चा कैसा दिखाई देता है. Saltatory में symptoms evolve over days to weeks. Symptoms involved over days to weeks. What symptoms, sir? The baby will have lethargy, apnea, all the symptom of sepsis kind of a thing, tone abnormalities, tight popliteal angle on examination. Are you understanding? Yes or no? Again, रटना नहीं है, इसे रटने वाली कोई बात नहीं है. You don't have to cram every line. Just have a broader picture that IVH could be clinically silent, could be saltatory, could be catastrophic. Catastrophic is very bad, but it is least common. Silent is very common in this one. And but in silent, clinically silent, baby sudden within 24 hours, baby will go to the God. भगवान के पास चला जाएगा. एकदम अनएक्सप्लेन फॉल इन HP, अनएक्सप्लेन फॉल इन हेमाटोक्रिट, सडन पैलर, अनएक्सप्लेन पैलर. बच्चा तो बिल्कुल ठीक था, ये पैलर कहाँ से आ गया? सो ही इज ब्लीडिंग आउट, ही इज ब्लीडिंग आउट फ्रॉम द ब्रेन. आर यू अंडरस्टैंडिंग? इन सॉल्टेटरी द symptoms come over days to weeks, over days to weeks. What symptoms are? Could be anything, could be lethargy, could be apnea, could be any tone issues, hypotonia, hypertonia, or tight popliteal angle on examination. Did you understand this much, everyone? Yes or no? Isha, Sandhu, Hamid, Sandhu, everyone. Beam, combat, okay? Very good, perfect, okay? And also tight popliteal angle. I would like to ask one question. Now let me check if you have really revised the previous segments or not. Isha, tell me one thing. In the Ballard score, in the expanded new Ballard score, you know, right? We give the points like -1, 0, 1, 2, 3, 4, like that by looking at the baby's pictures. That कितना point देना है. If -1 होगा, baby is on the preterm side, and if you give 4 scoring, baby is on the term side, which is in what parameters you give 5 score also in Ballard score. In what parameters, in what physical or any neuromuscular parameters you give the score till 5. because mostly scores are given till 4, but there are 2 points where you give score till 5. Any random guesses? क्वेश्चन समझ में आया या ऊपर से चला गया जो पूछा मैंने? हामिद, भीम, संधु, ईशा, अब बताओ जल्दी से, जबान खोलो, ऐसे करो. Very good. So yes, you all remember, right? In the expanded new Ballard score, yes or no? Have we read this Ballard score? There were signs of neuromuscular maturity and physical maturity. इसमें याद है ये आपको? We had -1, 0, 1, 2, 3, 4. All parameters are till 4, but fifth parameter or the fifth score, this is the scoring, okay? The 5 score we can go till the popliteal angle only and also on the skin. याद है नहीं याद? Skin भी 5 तक जाता है. 5, 4, 3, 2, 1, 0 और -1. So skin parameter can go till 5 and popliteal angle can go till 5. याद है कि नहीं याद है? समझ में आया? अब याद आ गया? हामिद, ईशा, ये पढ़ा मैंने कहा था एक्सपेंडेड न्यू बलार्ड स्कोर में देयर इज अ स्कोर वी गिव, ओके, फ्रॉम -1 to 4, but there are only two parameters where we give the score till 5, that is popliteal angle and also that is skin. Popliteal angle and skin. अब याद नहीं आया? अब तो आ गया ना याद? ठीक है, ये इंपॉर्टेंट है, जिपमर में आया था क्वेश्चन. जिपमर कभी दोगे तो उसमें ये क्वेश्चन आएगा. ठीक है, डन. सो वाई, ये बात यहाँ क्यों आ गई? क्योंकि यहाँ पे मैंने लिखा है टाइट पोप्लिटियल एंगल ऑन एग्जामिनेशन. डियर, वी हैव टू लिंक एंड स्टडी, वी हैव टू लिंक एंड स्टडी. सो टाइट पोप्लिटियल एंगल ओवर हेयर ऑल्सो, एंड इन जनरल पोप्लिटियल एंगल गोज टिल 5 स्कोर. ईशा, डिड यू पुट इन योर नोट्स? यू हैव टू improve your brains. Okay, okay, next question. Yes, so clinically silent over, saltatory over. In the clinically silent, there was a unexplained pallor, unexplained fall in hemoglobin, unexplained fall in hematocrit. Saltatory goes over days to weeks with all the lethargia, tone issues and everything, and seizures. Catastrophic, yeah, this is a good one. Catastrophic is very less common, least common, because there is rapid evolution. Rapid evolution in hours. घंटों में बच्चा जाता हुआ दिखाई देता है, घंटों में. In hours the baby looks like going very sick. Okay, that you should know. Like kind of a मतलब means what? Kind of a decorticate and decerebrate. Anyone, what is decorticate, what is decerebrate? Who will tell me? Hamid, Bhim, Sandhu, Isha, कॉम्बैट. व्हाट इज डी भीम? व्हाट इज, एक होता है डी कॉर्टिकेट, एक होता है डी सेरिब्रेट. नाम सुना है? हैव यू हर्ड द नेम्स? हैव यू हर्ड ऑफ जीसीएस स्कोरिंग, ग्लासगो कोमा स्केल, जीसीएस स्कोरिंग? व्हाट इज द मैक्सिमम जीसीएस स्कोर? What is the maximum GCS score? Yeah, very good. Isha is now answering. Remember, in GCS score, we have total 15 tak we can go to the score. We have something known as EVM. In that, we have eyes, verbal, and motor. In the motor itself, we have something known as decorticate and decerebrate. Yeah, very good. So this is now this very important picture. Abnormal flexion. Abnormal flexion is decorticate, and abnormal extension is decerebrate. Abnormal flexion, abnormal extension, abnormal flexion, abnormal extension. When the photographic memory is everything in life, for me from last 10 years I have only seen the photos and remember the patients, remember the diagnosis. So decorticate, whether there will be abnormal flexion at the hands, and in decerebrate there will be abnormal extension of the hands, because the limbs in decorticate and decerebrate both will be extended only the hands in decorticate will be abnormal flexion, and abnormal extension is in the decerebrate. And decerebrate is more bad, okay, it is more bad, because in glaucoma scale, in the EVM, eyes, verbal, motor, first come in the motor, like first is the decorticate and then it is the decerebrate. तो ये क्या है? ये catastrophic symptoms हैं, catastrophic symptoms हैं in the cases of IVH. Okay, done. So there will be decorticate, decerebrate, hypotension, death, all those things will be there. Okay, yeah, next question. Whom to screen for IVH? Okay, no problem, Isha, I can understand, dear, no problem. Let's just continue with me, how much ever you are able to get it, and later you can watch the lecture fully also. Okay, so whom to screen? Yeah, this Osama has come. Osama, what's up? बेटा तुम भी लेट आए हो, ये सारे लेट उठने वाले हैं मेरे ख्याल से, कोई सुबह नहीं उठता. व्हाट टाइम डू यू गेट अप एवरीवन? व्हाट टाइम डू यू गेट अप? हामिद, व्हाट टाइम डू यू गेट अप इन द मॉर्निंग? 5 o'clock, 4 o'clock, 3 o'clock? Isha, what time do you get up? You get up at 10 o'clock, I guess. Osama, what time do you get up? 11 o'clock, 11:30, huh? Very good, very good. Okay. Hmm. Yes. So home to screen. So now we have covered around 40 minutes of this session. 5 more minutes, then we're gonna shut down this topic, and at 1 o'clock we'll do the part two of this topic. So home to screen for IVH. किन बच्चों को करना चाहिए? Okay. Bhim says he got up at 8 o'clock. Osama says I'm sorry. बेटा sorry से काम नहीं चलता. Sorry से काम नहीं चलता. Time पे आते हैं, my dear. Okay. Hmm. Sandhu says, I haven't slept, sir. Seriously? I mean, seriously, you didn't sleep whole night like you were studying? My goodness, Sandhu. बेटा इतना बड़ा ही मत करो यार. Chill. Life is beautiful. Go out. Okay. Yeah. So whom to screen? Kin babies go? Whom to screen? Every baby should I screen? This 3 kg baby admitted. Should I screen him? 3.5 kg baby I admitted. Should I screen him? A baby was admitted for jaundice. Should I screen him also? Like whom to screen for IVH? Please remember, very important, the high risk babies. High risk babies are the one to be screened for IVH. Sir, high risk matlab, what are high risk? Like mota mota, what I should know? Babies who are less than 32 weeker and baby who are less than 1.5 kg. Very important, very important. Babies who are less than 32 weeker and babies who are less than 1.5 kg should be screened for IVH. Should be screened for IVH. That is the first point. Less than 32 weeker and less than 1.5 babies should be screened for IVH. ठीक है, पहली बात. Because less than 32 weaker, their vessels are very immature, germinal matrix is very sensitive, so bleed हो सकता है, trauma हो सकता है, तो करेंगे screen. ठीक है. Next very important point, what about 32 to 34 weaker? Now this is the next question, very important NEET PG question, because just now I told कि भाई less than 32 को तो करना ही करना है बोल के करना है. तो what about 32 to 34 weaker? Because हमने वहाँ पढ़ा था ना स्लाइड के शुरू में कि after 34 weeks, you know, the whole germinal matrix involutes and integrity is maintained. What about 32 to 34 weaker? इनको छोड़ दें या इनका क्या करना चाहिए हमको? So Nelson says that less than 32 weaker you will what do you call yeah, Isha is answering so good. Isha, tumne have you, I think you have attended my previous lectures. The way you're answering is awesome. Okay. Where I was, huh? So bhaiya, tell me one thing, whom to screen? Sir, less than 32 weeker baby admitted or less than 1.5, screen them for IVH. Take them to a bedside transcranial ultrasound. Acha, theek hai. What about 32 to 34 weeker? For 32 to 34 weeker, anyone having a bad neonatal course will also be screened. A baby between 32 to 34 weeker with a bad neonatal course. Bad neonatal course is nothing but what you called that baby was requiring shock, maybe, you know, or requiring dobutamine inotropes. Maybe that baby has again unexplained anemia. 32 to 34 weeker baby had unexplained anemia, so definitely I have to screen him for IVH, है ना? Any severe respiratory distress who required ventilator setting, and also yeah, these are the points I will be, you know, any baby who is between 32 to 34 weeker with a bad postnatal course, bad neonatal course, उनको तो screen करना ही करना है. I'll repeat again. Home to screen for IVH. Sir, less than 32 weeker baby to you have to screen for IVH and less than 1.5 kg. Okay, what about 32 to 34 weeker? Sir, any baby with a bad NICU course. For example, the baby was in shock, baby required dobutamine, baby had unexplained anemia, baby was on ventilator. So these all babies can land up into intraventricular hemorrhage. So, है ना? That's what you should know. Okay, Isha, cool. I got it, Isha. Okay, समझ में आ गया ना इतना? Very good. Okay, that's it. Now 2 more minutes, then I'm gonna shut down this topic because the part 2 will do it on at 1 o'clock today. So again, consequences of IVH. Consequences of IVH. अब होगा क्या? Like what can happen? This germinal matrix was there na, and this intraventricular hemorrhage. Germinal matrix was involving, then lateral ventricle involving, then ventriculomegaly takes place. इतना कुछ हो गया, इतना कुछ लाइफ में हो गया मेरी. तो what are the consequences? क्या हो सकता है आगे? What are the consequences? Isha, what do you think? I will not tell before you open your mouth. You have to open your mouth. Hamid, Sandhu, क्या होगा? Yes, very good. Isha is right. So the first thing will happen to damage to the germinal matrix, है ना, खराब हो जाएगा. If there is too much of intraventricular hemorrhage, there will be damage to the germinal matrix. That is the first point. और क्या होगा? There will be PVHI. Now this is very important. What is PVHI? I told you the grade 4. What is grade 4 of IVH? Grade 4 IVH is nothing but PVHI. What is PVHI? Periventricular hemorrhagic infarction. Periventricular hemorrhagic infarction. This is what will happen as a consequence of intraventricular hemorrhage. पेरीवेंट्रिकुलर हेमरेजिक इन्फाक्शन है ना, ये पढ़ा था अभी हमने. मतलब इसका फोटो, इफ यू सी द पिक्चर ऑफ दिस, सी दीज आर द, लिसन वेरी केयरफुल, दीज आर द वेंट्रिकल. कैन वी अप्रिशिएट, इनको वेंट्रिकल्स कहते हैं. दिस इज द, these are the ventricle, okay, and this part, this black this thing, this is the hemorrhagic infarction. This one, periventricular, okay. I'll repeat again, these are normally are the ventricles, but this part, this part, ये वाला, ये this part, this is the periventricular, ventricle के इर्द गिर्द hemorrhagic है, there is a hemorrhage and leading to infarction, PVHI. So the consequences, this also, see, it's a very nice picture. See this one, this is whole is the normal stuff, and this part, this is the periventricular hemorrhagic infarction. Why I'm showing so many pictures, because photographic memory is everything. See, this is the hemorrhage, this ये वाला, because अंडरस्टूड ना. दिस इज तो नॉर्मल, ये तो नॉर्मल हमारा लैटरल वेंट्रिकल होता है ये वाला, एंड इसके पास में पेरीवेंट्रिकुलर देयर इज हेमरेज एंड देयर इज इन्फाक्शन, एंड यू कैन सी अ हेमरेज हियर, यू कैन सी अ हेमरेज हियर. Photographic memory is everything in life. You should see the picture. If they have to make the paper tough, they can ask you this MRI picture. The MRI picture shown in this newborn baby represents what kind of this part, sir, it represents nothing but periventricular hemorrhagic infarction. Okay, done. So the consequences of what you called our intraventricular hemorrhage, या तो germinal matrix का hemorrhage damage होगा, either there is periventricular hemorrhagic infarction, and last but not the least, PHH. What is PHS? Post hemorrhagic hydrocephalus. Post hemorrhagic hydrocephalus. Because why, sir, why hydrocephalus? Because I told you, no, there is like, this is the lateral ventricle, right? Then we have the third ventricle, and then we have the fourth ventricle. So lateral ventricle and third ventricle is connected by foramen of Monro, and third ventricle and fourth ventricle are connected by aqueductal canal of Sylvius. So because when so much of hemorrhage and trauma is happening, this aqueductal canal can cause stenosis, and once there will be stenosis of this aqueductal canal, the CSF which will be there will get accumulated, and that lead to CSF accumulation, and that will lead to hydrocephalus. So post hemorrhagic hydrocephalus. I'll repeat again, why post hemorrhagic hydrocephalus? Because understood, no, because post hemorrhagic there will be hydrocephalus because aqueductal canal of Sylvius will get blocked, and the CSF which runs from lateral ventricle to third ventricle to the fourth ventricle will not able to flow, and there will be CSF accumulation. Okay, done. So this is a very beautiful picture of post hemorrhagic hydrocephalus. Can we see the dilatation of the ventricles? The ventricles are fully dilated. So this normally it should be only itna sa. This is the normal. This much is normal, but this big one is nothing but post hemorrhagic hydrocephalus. So that's, you should know. Okay. Yes, that's it. So that finishes this one segment of what you called IVH. Second part I will deal at 1 o'clock. Okay, let's have a very quick revision. Let me ask you the question. Let me ask you question number 1. Okay, I have 5 questions to ask you for this one. Question number 1. Expanded new Ballard score. Expanded new Ballard score can be done for what to what weeks of baby? कितने हफ्तों के बच्चे बलार्ड स्कोर से हम डिटेक्ट कर सकते हैं? How many weeks old baby can we detect from the Ballard score? Let's see if you can answer. Sandhu, Isha, our Hamid and Bheem and Combat. How many weeks baby can we diagnose from the Ballard score? So remember 20 to 44 weeks baby है ना, 20 weeks baby से लेके 44 weeks baby तक we can analyze by doing the Ballard score, by the scarf sign, and that I told you, right? Scalp hair, breast nodule, lanugo, and this genitals, and permanent plantar crease and all that. Question number two. Question number two. What is lanugo? In every class, I'm thinking I should take a test in the end of whatever we have taught. What is Lanugo? Isha, what is Lanugo? Sandhu, Bhim, and Combat, and Hamid. Lanugo का मतलब क्या होता है? Lanugo, what is Lanugo? It's okay, Isha, I can understand, no problem. But you're trying, no. Trying is the best thing. Mistakes are proof that you're trying. Okay, yes. So Lanugo is abundant hair. Abundant hair at the shoulder and the back. Abundant hair at the shoulder and the back. It is seen in terms or preterms? Yeah, very good. So Isha is already answering preterm hair. Preterm hair is right, my dear, but which hair? The preterm scalp hair? No. Preterm hair at the shoulder and the back. That is known as lanugo. Question number 3. What is the latest under 5 mortality rate? That is the third question. Total, I'll ask you 5 questions. What is the latest under 5 mortality rate? What do you think? Anyone? Very good, Osama. Very good. Yes, that's right. What is the latest under 5 mortality rate? Hamid, Sandhu, Osama, Isha, Combat. Very good. So you know that, anyone? Yes. So 18 plus 6 is 24, 34, and 39. These were the 5 mortality rate. 39, yes, is under 5 mortality rate is 39. Okay. Infant mortality rate is 34. Neonatal mortality rate is 24. Early neonatal mortality rate is 18, and late neonatal mortality rate is 6. So early neonatal mortality rate is 18, late is 6, total is 24. Then we have 34 infant mortality rate and 39 under 5 mortality rate. Sandhu, it is 39, not 38. OPK 9th edition says it is 39. It is 39. Okay, second last question. Question number 4. What is the cutoff of hypoglycemia in newborns? What is the cutoff of hypoglycemia in a newborn? Anyone? What is the cutoff of hypoglycemia in the newborn? कितना RBS रैंडम ब्लड शुगर लेस देन कितना होए बोलेंगे कि भाई दिस इज द कट ऑफ ऑफ हाइपोग्लाइसीमिया इन द न्यूबॉर्न? संधु, ईशा, ओसामा, कॉम्बैट, हामिद. बेटा रिवाइज कर लो तुम, मैं रिवाइज कर लो तुम, वरना मेरे मेरे हाथ से तुम गए जाओगे फिर. So yes, hypoglycemia in the newborn, we know that, I'm putting a empty paper. Yeah. So 45 and 54. Less than 45 milligram per dl is nothing but neonatal hypoglycemia, and less than 54 milligram per dl is hypoglycemia in severe acute malnutrition. Okay, 45 and 50. Osama, it is 45. Isha is right, 45 and 54. What is the drug of choice? Like what is the fluid of choice we give for hypoglycemia? Anyone? What is the fluid of choice? Isha, क्या देते हैं हम? Osama, Hamid, Sandhu, Osama, yeah, very good. So we give 10% dextrose. In both cases, if the fluid have to give, normally less than 45, you give breastfeeding, tube feeding, katori spoon feeding, then check the sugar. But if I talk about only fluid of choice, then 10% dextrose देते हैं sir. कितना देते हैं sir? 2 ml per kg of 10% dextrose we give for neonatal hypoglycemia. Whereas 5 ml per kg of 10% dextrose we give for SAM hypoglycemia. SAM hypoglycemia, है ना? That's very good. Last question. Okay. Last question. What should I ask? Should I ask something tough or should I ask something average? Okay. What are the 10 steps of warm chain? What are the 10 steps of the warm chain? First of all, warm chain कहाँ पे पढ़ते हैं हम? Warm chain is we do it for hypothermia. To prevent the hypothermia in the child, I will do something known as warm chain. So can anyone tell me the steps of warm chain? Anyone? Yes. So number 1, yes. Isha says tough. Nothing is tough. You just revise. Something is tough, you divide it. 10, no, 10 steps is very, very easy. See, Isha, it's easy. Imagine. You enter the delivery room. So first is warm delivery room. Okay, imagine. Okay, imagination is the key. Warm delivery room, number one. So once you enter the delivery room, warm delivery room, वहाँ सामने कुछ रखा है, क्या रखा है? There is a resuscitation corner. So warm resuscitation corner or neonatal corner, the neonatal warmer only I'm talking. I'll repeat again. I enter the labor room. So warm delivery room, warm resuscitation corner, और वहाँ पे बच्चा लेटा हुआ है. The baby is there. So immediate drying. Baby is lying down there, no? So immediately you dry the baby, okay? Immediately drying. Why? Because you want to prevent hypothermia. That's why. So immediate drying, and then what? Then skin to skin contact. Skin to skin contact. Skin to skin contact. Fifth and sixth are B and B. Fifth is breastfeeding, and next B is bathing postponed. समझ में आ रहा है इतना? Yes or no? Isha is answering. Yes, very good, Hamid. I'm happy you're answering. Answer. Try to answer. Sandhu, try to answer. Little also you'll get it. Okay. दोबारा पूछूंगा तो 5 के 6 याद रहेंगे, फिर 8 याद रहेंगे, ऐसा हो जाएगा. So I'll repeat again. You entered the labor room. What did you do? You saw that labor room is very warm. So warm delivery room, warm resuscitation corner. The baby was lying down there. What did you do? Immediate drying. Then you the skin to skin contact you did to the baby. 5 and 6 are breastfeeding and bathing postponed. Once I do the bathing postponed, then अब अगर नहाना लेट है तो क्या करें फिर? कपड़े डाल लो फिर, और क्या करोगे? So appropriate clothing. Appropriate clothing. Yes or no? Appropriate clothing. After clothing, keep the baby and mother together. So mother and baby together. Mother and baby together. Number 8. And 9 and 10 is nothing but anyone? Yes. 9 is professional alertness. Professional alertness. And last is warm transportation. Warm transportation. That finishes the whole 10 steps of the, what do you call it, warm chain. ठीक है, समझ में आ गया? Yes, very good, very good. So that's it. और जाने से पहले हमारा एक motivating quote which I have written. Let me just go through it once. I want you to have the motivating quote before leaving any class. So the today's motivating quote we have, it says is that be strong. Be strong. You never know whom you're inspiring. So be strong. Be strong. You never know whom you're inspiring. Like it sometimes it goes to me also. Sometimes when my mood is off or sad, but I'm like, no, no, no. You be strong, because you never know whom you're inspiring, because people get affected by you, right? If your face is happy, then I'll be happy. If your face is negative or sad, I'll also kind of be like, uncomfortable with that. So be happy, be strong. You never know whom you're inspiring. कभी कभी दूसरे को देख के भी जिंदगी जीने का मन करता है. तो अपनी शक्ल ऐसी ना बना लो कि तुम्हें देखते ही बंदा परेशान हो जाए. तो बी स्ट्रॉन्ग एंड बी हैप्पी. यू नेवर नो whom you are inspiring. So it's a very beautiful quote. Be strong. You never know whom you are inspiring. So I think it's a nice quote. Yeah. Okay. समझ में आ गया. थैंक यू सो मच फॉर द पार्टिसिपेशन. संधु, हामिद, हाँ जी सर. मैं करता हूँ पहले 1 बजे, फर्स्ट 1 o'clock वी गोना मीट एंड वी गोना डू द पार्ट 2 ऑफ दिस सेगमेंट, एंड देन विल डू अकॉर्डिंगली. ठीक है हामिद, मैं देखता हूँ कैसे भेजते हैं इसको, मैं भेज दूंगा. ठीक है. थैंक यू सो मच. बाय बाय. जाओ अपने अपने घर जाओ, ब्रेकफास्ट करो. आई विल हैव आलू का पराठा.